For more analysis, we can speak now to psychologist Dr. Karen Sadlier. Thank you very much indeed for speaking to us, Dr. Sadlier. Could you tell us, what would you say is the impact on people's psychological well-being when they're confined to their home? And how does it manifest itself?
Well, we are seeing quite a lot of people who are having symptoms and depressive symptoms. And some of these symptoms can turn into post-traumatic stress disorder. One of the difficulties in terms of this world crisis is that for people to do well in a very stressful situation, aside from everything that your correspondent just noted, which is extremely true, one of the things is having social support. And this is a difference between people in submarines, social support among the crew members, as opposed to people who are locked down alone in their apartment or alone with friends or family or their partner. The possibilities for social support are really reduced. So one of the most important things right now is...
All right, okay. I'm sorry. We seem to be having a little bit of difficulty hearing you there. I think we'll probably have to move on and try to come back to you a bit later. So thank you in the meantime for staying with us. Dr. Karen Sadlier, we'll try to get back to you a bit later on. Moving on now, the British Prime Minister Boris Johnson is reported to be stable after spending a second night in intensive care at a London hospital. He tested positive for COVID-19 2 weeks ago and was admitted to St Thomas's Hospital on Sunday evening. Well, the 55-year-old has been receiving oxygen support but is not on a ventilator. Well, during his absence from 10 Downing Street, the Foreign Secretary Dominic Raab is at the helm. This as the UK faces one of its gravest crises in many decades. France 24's Bénédicte Paviot has this update for us from London.
It hasn't changed significantly, but experts, medical experts, doctors, have been on the media in the last hour as a result of this latest bulletin being issued by Downing Street about the Prime Minister Boris Johnson's health. And they say that this is a good sign that his condition actually hasn't worsened, which can sometimes happen when you are admitted to the intensive care unit. So the Downing Street language, let me quote it directly. The Prime Minister is responding to treatment, and also officially Downing Street saying he remains clinically stable in intensive care unit in London St Thomas's Hospital. He is responding to treatment, as I said, receiving standard oxygen. He is not, we're told this again, on a ventilator, and that is underlined. He is in good spirits, which means he is conscious, he can contact people. And today, interestingly, this new line, because there's been a lot of controversy about the fact that he was admitted to hospital on Sunday evening, allegedly for precautionary measure, but that he was still working from his bed. We were even told that on Monday afternoon, and then a few hours later, he was admitted to the intensive care unit. Today, this new line, which is interesting, the Prime Minister is not working, but has, I'm still quoting, the ability to contact those he needs. So I think it's good news, but as you say, not a significant change.
France 24's Bénédicte Paviot reporting there from London. Now, the death toll in the United States is now the third highest in the world, with around 400,000 COVID-19 infections. The US has the highest number of cases of any country in the world. Well, New York alone reported the deaths of 731 people on Tuesday, but President Donald Trump says the US could be approaching the top of the curve.
A bright spot in New York's hardest day so far. Firefighters, first responders and healthcare workers come together to applaud those fighting the pandemic. As deaths hit new highs, New York State's governor said the rate of hospital admissions seemed to be levelling off. A sign the crisis might be peaking is little comfort to Jacqueline Callahan, a nurse at a busy New York City hospital.
There are, of course, tons of people who come in with mild cases, and that's wonderful that they can recover and go back out and be okay. But there are also a plethora of people who are just incredibly sick in a way that I've never experienced or seen before.
In Louisiana, another hard-hit state, the health department has released some worrying figures. Despite only making up a third of the population there, African Americans account for 70% of the total number of deaths from COVID-19, highlighting disparities in health and unequal access to medical care.
We're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care.
Unemployment is soaring across the country, with many businesses closing down amid quarantine measures. President Donald Trump has reiterated that he wants to reopen the US economy soon.
Now, according to the Health Ministry data, Israel has reported more than 9,400 cases of COVID-19 and at least 71 deaths. Well, today, a heightened lockdown has come into effect, leaving the streets of Jerusalem and other cities almost entirely deserted. Well, today is the first day of the week-long Jewish Passover holiday, which is usually an event that brings people together. But special restrictions, including a curfew and a travel ban between cities, have been imposed to try and halt the spread of the disease. France 24's Iris Makler in Jerusalem tells us more.
Right now, at this time, the curfew is going into effect. It's unprecedented, and it is related to Passover. Passover, I think, is the most important festival in the Jewish calendar. It's a big family festival, and the aim of this curfew, this lockdown that lasts just under 72 hours, is to make sure that no one spends Passover with their families. Prime Minister Benjamin Netanyahu, announcing this unprecedented move, said that in the previous Jewish festival a month ago, Israel had allowed celebrations. What followed was a spike in infections. He said that this is a life-saving measure. It wasn't going to go ahead. And looking ahead, as your discussion has been, to what happens next, he said, our figures in Israel, says Benjamin Netanyahu, are quite good. 9,000 or so people infected, 70 or so deaths. And he said, perhaps at the end of Passover, we can look forward to phased steps to come out of this very strict lockdown.
France 24's Iris Makler reporting from Jerusalem. Now, according to a global tally put together by Reuters news agency, Senegal has 237 cases of COVID-19 and 2 deaths have been reported there. Well, to prevent the further spread of the virus, the country's schools and universities are closed. Public gatherings are banned and volunteers have been mobilised to help educate people. Well, the France 24's Observers team have been talking to one such volunteer.
Mamadou Junior Diakate is a teacher in Dakar, the capital of Senegal. He helped found a group called the 100 Volunteers. They fan out across the nation, trying to get the right kind of information out about the coronavirus. Basic sanitary information that can help stop infections.
L'initiative des 100 volontaires a vu le jour au Sénégal à partir des réseaux sociaux. C'est à partir du 2 mars, les volontaires se sont déployés un peu partout au Sénégal pour sensibiliser sur le coronavirus et sur les mesures de prévention simples. Nous nous sommes rendus dans des écoles coraniques où des maîtres coraniques continuent à donner des cours malgré l'interdiction de l'État sénégalais. Et on a eu à sensibiliser ces maîtres coraniques sur le danger de rassembler ces enfants. ñu set ku ñëw kër ga rek nekk gan ngeen utal ko fu mu raxasoo ba mu set ñu doog a toog yow boo demee bitig ba dellu si nga daal di raxas sa loxo. Par la sensibilisation, on a réussi à libérer pas mal d'écoles. On se rend dans des quartiers pour installer des dispositifs de lavage à l'entrée et à la sortie de chaque ruelle. Chaque passant a l'obligation de se laver les mains. Voilà, donc ici on lui demande de respecter les distances réglementaires, c'est-à-dire faire la queue en respectant 1 mètre au moins. Nous sommes rendus aussi dans des maisons pour distribuer des kits de propreté permettant à des familles défavorisées d'avoir de quoi se laver les mains chaque jour. Les 100 volontaires travaillent de manière bénévole et nous recevons des dons à partir du site internet 100volontaires.webflow.io. Nous sommes un peu partout au Sénégal et à partir de groupes WhatsApp bien organisés, parvenons à donner la bonne information reçue du ministère de la Santé.